Hey everyone, and welcome back. I'm always excited to jump into these deep dives with you, and today we're going down a path I honestly hadn't considered before.
Oh, really? You haven't heard about this before?
Not really. I knew there were a lot of comorbidities with autism, which we'll talk about,
Right.
but the connection to pulmonary hypertension wasn't on my radar.
Well, get ready to be surprised
hmm
because it's a connection that deserves way more attention than it gets.
I'm sure. And to help us unpack all of this, we're diving into an article from Cheap ABA called Understanding Autism and Pulmonary Hypertension, a Hidden Connection.
Great article. It lays things out really clearly.
It does. So let's start with the basics for anyone who might not be familiar with pulmonary hypertension. What exactly are we talking about here?
So pulmonary hypertension, or PH, is basically high blood pressure. But here's the thing. It's not your overall blood pressure we're talking about. It's specifically in the arteries that carry blood from your heart to your lungs.
Okay, so it's like a very specific kind of high blood pressure?
Exactly. And because it affects those lung arteries, it can lead to some pretty serious problems.
Like what kind of problems are we talking about?
Well, think about it. If those arteries are constricted, it's harder for blood to flow through them, and that means your heart has to work harder. Over time, this can lead to all sorts of issues like shortness of breath, fatigue, chest pain, even heart failure in severe cases.
Wow, that's a lot more serious than I think people realize. And the article mentions that about 70% of children with autism have at least one additional health condition.
That's a staggering statistic, isn't it? And it just goes to show that when we're talking about autism, we can't just focus on the behaviors. We need to look at the whole picture, including these potential physical health connections.
Absolutely. It's all interconnected. And speaking of connections, the article goes on to highlight obesity and lack of physical activity as major risk factors for PH. And then they hit us with this stat: over 40% of children with ASD are overweight or obese. That's a pretty alarming combination.
It is, and it really underscores the need for early intervention and support around healthy lifestyle choices for individuals with autism. We're not just talking about managing weight here. We're talking about potentially reducing the risk of developing a serious condition like PH down the line.
Okay, so we've got this connection between autism and PH, and we know that obesity and inactivity are big risk factors, but what can families actually do with this information? What are the first steps?
Well, the first step is awareness, knowing this connection exists and that it's something to take seriously. The article stresses that early detection is key because the earlier PH is diagnosed, the better the chances of managing it effectively.
So knowledge is power in this case, but what does that look like practically? How can families be proactive about this?
That's a great question, and it involves a combination of being informed and being observant. So first off, talk to your child's doctor. Let them know about this potential link between autism and PH. Ask about screenings, even if your child doesn't show any obvious symptoms.
So it's about advocating for those screenings, even if they don't seem directly related to autism at first glance.
Exactly. Your child best. So if you notice anything unusual, like shortness of breath after light activity, or if they're complaining of chest pain or dizziness, don't brush it off as just being tired or even as behavioral. These could be signs of PH.
It all circles back to that holistic approach we were talking about earlier. You can't just compartmentalize when it comes to health. And speaking of connections, the article delves into the genetic component of all of this. Apparently, certain genetic syndromes like Down syndrome can be associated with both autism and PH.
It's true, and while we're still learning about the intricacies of these genetic links, it's clear that genetics can play a significant role.
So it's not just about lifestyle factors. There's a potential genetic predisposition at play here as well.
That's huge.
And it makes me wonder, what about families who are already navigating the challenges of autism? How do they process this added layer of complexity?
It's a lot to take in, for sure, and it highlights the importance of open communication with your child's healthcare providers.
So families need to be upfront about their family medical history, any genetic syndromes or heart conditions that might be relevant.
Exactly, because that information could be crucial in guiding their child's care.
So we've talked about the connection between autism and PH, the risk factors, and the importance of early detection. But what about treatment? What can families expect if PH is diagnosed?
That's where things can get a little tricky because treating PH in children, especially those with autism, can be complex.
In what way?
Well, for starters, there's no one-size-fits-all approach. Treatment plans are highly individualized and depend on a variety of factors, including the child's age, overall health, the severity of their PH, and of course their individual needs and challenges related to autism.
So it's not as simple as just prescribing a medication and calling it a day.
Not at all. It often involves a multidisciplinary team of specialists working together to create a comprehensive care plan.
What kind of specialists are we talking about here?
Well, you'll likely be working with a pediatric cardiologist who specializes in heart conditions in children, a pulmonologist who focuses on lung health, and potentially other specialists depending on your child's specific needs.
So it's a team effort.
Absolutely. And that team will work closely with you to develop a plan that addresses your child's unique needs.
What kinds of treatments are typically used for PH in children with autism?
Well, as I mentioned, it varies, but treatment often involves a combination of approaches.
Okay, so walk us through some of those approaches.
One common approach is medication. There are medications that can help relax and widen the blood vessels in the lungs, which can lower blood pressure and make it easier for the heart to pump blood.
That makes sense. So it's about improving blood flow and reducing the workload on the heart.
Exactly.
Hmm.
And in some cases, supplemental oxygen might be necessary to help improve oxygen levels in the blood. This can be especially helpful for children who experience shortness of breath.
So we've got medications, oxygen therapy. What else?
Yeah. Well, in addition to medical interventions, there's a big focus on lifestyle modifications. We talked about obesity and inactivity as risk factors. So encouraging regular physical activity, even in small, manageable ways, can make a big difference.
I imagine that could be challenging with some children with autism.
It definitely can be,
Yeah.
which is why it's so important to find activities that the child enjoys and to work with them at their own pace. Even short bursts of activity throughout the day can be beneficial.
And what about diet? Any specific dietary recommendations for children with PH and autism?
There's no specific pH diet, but a healthy, balanced diet is always a good idea. Focus on whole, unprocessed foods, fruits, vegetables, lean proteins, and healthy fats. And of course, limit processed foods, sugary drinks, and unhealthy fats.
So basically the same dietary advice you'd give to anyone looking to improve their overall health.
Pretty much. It's all about making sustainable changes that promote overall well-being.
So we've talked about treatments, but I want to circle back to something you mentioned earlier, early detection. The article really stresses how crucial this is. Can you elaborate on why that is?
Sure, early detection of pH is so important because it allows for timely intervention. The earlier we can start treatment, the better the chances of slowing down the progression of the disease and preventing serious complications.
So it's about getting ahead of it before it has a chance to cause too much damage.
Exactly. And this is especially important for children with autism because they might not be able to communicate their symptoms as clearly as other children.
That makes a lot of sense. So families and caregivers really need to be vigilant about those potential warning signs.
Absolutely. Pay attention to any changes in your child's behavior or energy levels. If you notice anything unusual, don't hesitate to talk to their doctor. It's always better to err on the side of caution.
This has been incredibly eye-opening. We've covered a lot of ground, but I'm sure our listeners are still wondering about something. What about the emotional and mental well-being of families going through this? Receiving a diagnosis of PH on top of navigating the complexities of autism can be incredibly overwhelming.
You're right, it can feel like a lot to process. Suddenly you're dealing with medical appointments, treatments, lifestyle changes. It's a lot to handle.
So where can families turn for support? What resources are out there?
That's where connecting with others who understand what you're going through can be so valuable. There are support groups, both online and in person, specifically for families of children with PH.
So they can connect with other families who get it, who've been there?
Exactly. They can share their experiences, offer advice, and just know that they're not alone in this journey. And don't underestimate the power of professional support as well. Therapists and counselors who specialize in autism can provide families with coping mechanisms, communication strategies, and the tools to navigate the emotional roller coaster that often accompanies these types of diagnoses.
It's like building a network of support, both for the individual with autism and for the entire family.
Precisely because at the end of the day, this isn't just about managing a medical condition. It's about ensuring quality of life for everyone involved.
You've hit the nail on the head. It's about approaching health and well-being from a place of understanding compassion and proactive care.
Couldn't have said it better myself.
Yeah.
It's true, and it's like there's this whole other layer, isn't there? Because we often hear about the genetic component of autism itself.
Right, like how certain genes might make someone more susceptible to developing autism.
Exactly. But what this article highlights is that those same genes, or at least some of them, might also increase the likelihood of developing PH. It's like a double whammy.
Wow, that's a lot for families to process, especially those who might already be feeling overwhelmed just by the autism diagnosis itself. What advice would you give to those families facing this potential double burden?
You know, it's really about empowering them with information and encouraging them to be proactive.
So knowledge is power, as they say.
Absolutely.
Mhm.
And the first step is understanding their family's medical history. Is there a history of genetic syndromes like Down syndrome or other heart conditions?
Because that could signal a potential genetic predisposition.
Exactly. And armed with that knowledge, families can then have more informed conversations with their child's doctor.
So it's about open communication with healthcare providers.
Absolutely. Don't be afraid to advocate for your child. Ask about specific screenings for PH, even if your child isn't showing any obvious symptoms.
Because, like we talked about earlier, those symptoms can be subtle and easy to miss.
Exactly. And early detection is key here because it opens the door to timely intervention and better management of the condition.
It's about connecting those dots early on.
Hmm.
The article touches on how crucial early intervention is, but what does that actually look like in practice? What are we talking about here?
So early intervention can take many forms. On a medical level, it might involve medications that help to relax and widen those blood vessels in the lungs. This can help lower blood pressure and reduce the strain on the heart.
So it's about improving blood flow and making it easier for the heart to do its job.
Exactly. And in some cases, supplemental oxygen might be necessary to ensure the body's getting enough oxygen.
Makes sense, especially if shortness of breath is a major issue.
Right. And then beyond the medical interventions, there's the lifestyle piece we talked about earlier. Encouraging physical activity, even in small, manageable doses, can have a huge impact.
And I imagine that can be easier said than done with some children with autism.
You're absolutely right, which is why it's so important to find activities that the child enjoys and to work with them at their own pace. Even short bursts of activity throughout the day can be beneficial.
And how about diet? Are there any specific dietary recommendations for children with PH and autism?
Well, there's no magic pH diet, but a healthy, balanced diet is always a good foundation. Think whole, unprocessed foods, fruits, vegetables, lean proteins, healthy fats.
So basically the same dietary advice you'd give to anyone looking to improve their overall health?
Pretty much. It's not about deprivation. It's about making sustainable, healthy choices that benefit the entire body.
Makes sense. So we've got medications, oxygen therapy, lifestyle modifications. All of these things can play a role in managing pH. But let's circle back to something you said earlier about early detection. Why is that so crucial?
Well, think of it this way. The earlier we can catch pH, the sooner we can intervene and potentially slow down its progression. That early intervention can make a world of difference in terms of long-term outcomes.
So it's about getting ahead of the curve before the condition has a chance to cause too much damage.
Exactly. And this is especially important for children with autism because they might not always be able to verbalize their symptoms as clearly as other children.
That's a really important point. It highlights the need for parents and caregivers to be extra vigilant.
Absolutely. Pay attention to any changes in your child's behavior, their energy levels, their breathing. If you notice anything out of the ordinary, don't hesitate to bring it up with their doctor. It's always better to err on the side of caution.
It's like you said earlier, it's about that holistic approach, right? Looking at the whole child and a whole family.
Exactly. And finding that support, whether it's through support groups, therapy, or even just talking to friends and family, can make a world of difference.
It's that sense of community that can really help families navigate these challenges. And, it strikes me that this whole conversation highlights something really important. We often talk about autism in terms of the individual, but it really does impact the entire family, doesn't it?
Absolutely. It affects everyone in the household, and it's crucial that families have the resources and support they need to not just survive, but to thrive.
Couldn't agree more. Well, this deep dive has been incredibly eye-opening. We've unpacked some complex topics. But if our listeners walk away with just one thing, what would you want that to be?
If I could leave you with one thought, it's this. Knowledge empowers action. By understanding the potential link between autism and pulmonary hypertension, we can advocate for better screening, earlier interventions, and ultimately better outcomes for individuals with autism.
So well said. And for you listening, remember this conversation is just the beginning. If this episode has sparked any questions or concerns, please reach out to a healthcare professional. Your journey towards understanding and support is uniquely your own. Until next time, stay curious, stay informed, and keep asking those important questions.